neonatal glycemia and neurodevelopmental outcomes at 2 years. Definition: neonatal hypoglycemia is a common and readily treatable risk factor for neurologic impairment in children. Although associations between prolonged symptomatic neonatal hypoglycemia and brain injury are well established, the effect of milder hypoglycemia on neurologic development is uncertain. Application in medicine. We report the results of children with hypoglycemia and their later development study, a large prospective cohort study of term and late-term neonates born at risk from hypoglycemia. The study investigated the relation between the duration, frequency, and severity of the low glucose concentration in the neonatal period and neuropsychological development at 2 years.
In neonates, hypoglycemia is common, and in severe cases it can cause neurologic impairment. But how low is too low? It's currently recommended that neonates be screened and treated when the blood glucose is 60 milligrams per deciliter or less. But recent studies suggest that blood sugars as low as 47 milligrams per deciliter are safe. Lowering the clinical threshold would significantly reduce interventions. But would it affect child development outcomes? The CHILD study was a prospective cohort study of 528 neonates born at 35 weeks or more of gestation and considered to be at risk for hypoglycemia owing to maternal diabetes mellitus, prematurity, less than 37 weeks gestation, and other factors. All subjects were monitored and treated to ensure a blood glucose of 47 or higher. 53% of them required treatment for hypoglycemia with a blood sugar of less than 47. The primary outcome was the developmental score on the Bayley-III test at the age of 2 years, as well as measures of executive and visual function. At 2 years, developmental outcomes in the children treated for hypoglycemia were similar to those in the children who were also at risk but had not reached a glucose level below 47. There were no significant differences in the Bayley scores on measures such as cognitive, language, motor, social and emotional function, and adaptive behavior, or in the scores for executive and visual function. The authors conclude that neonatal hypoglycemia, when treated to maintain a level of at least 47 milligrams per deciliter, was not associated with adverse neurologic outcomes. Full trial results are available at nejm.org.
Pros and cons. Hypoglycemia, when treated to maintain a blood glucose concentration of at least 47 milligrams per deciliter, was not associated with increased risk of primary outcomes of neurosensory impairment. Risks were not increased among children with unrecognized hypoglycemia.
Congratulations on the birth of your new baby. We hope the transition to home life has been easy. We would like to give you a brief overview of the possible complication that your baby may experience called hypoglycemia. It is our intent to teach you the factors that may put your baby at risk for this complication, as well as the signs and symptoms and ways to prevent it. Hypoglycemia is a condition in which the baby's blood sugar drops below the optimal level. Many babies experience transient episodes of hypoglycemia that can be easily resolved by visiting your family's pediatrician.
We will open with Serena, a new mother who has come in for her baby's 2-day follow-up appointment. The nurse is going to teach her about conditions during pregnancy that can put the baby at risk for hypoglycemia.
There are a couple of maternal factors that can increase your baby's likelihood for developing hypoglycemia. Those include babies born to mothers with diabetes, whether it be gestational or lifelong, and babies born to mothers who had hypertension throughout the course of their pregnancy.
Fortunately, I avoided both of those complications during my pregnancy.
That's great. One of the major causes of hypoglycemia in a newborn is cold stress. This is when the baby becomes full and must use up her internal energy resources to generate heat. This is particularly important in preterm infants.
That sounds scary.
It can be. Luckily, cold stress is a factor that you and I can control by keeping a hat and socks on the baby, keeping the baby swaddled, and being aware of the temperature and air-conditioned spaces.
I do feel better knowing that I can keep Taylor from becoming cold.
You most certainly can. In fact, that's one of the most important things you can do as a mother, is be in tune to baby Taylor's needs and attend to them. Statistics show that baby boys are more likely to experience a dip in their blood glucose levels than baby girls are.
Well, I sure am lucky to have this sweet baby girl.
You sure are. One last thing. Infants who were born small for gestational age, or even appropriate for gestational age, but who were born prematurely, are also at a higher risk.
Taylor was born a few weeks early.
Okay, do you remember if the nurses ever took her blood sugar?
Yeah, they took it a couple of times, but thankfully it was normal each time.
Well, that's great. It sounds like you've got a healthy baby on your hands.
Okay, Serena, now that you know what factors put your baby at risk for hypoglycemia, we're going to discuss the signs and symptoms of hypoglycemia. That way, you will be able to tell if your baby is experiencing this phenomenon and needs to be taken to the hospital.
That sounds like a good idea. I definitely want to learn about this so I know what to do and how to keep my baby safe.
I'm glad you do, because this is important information. I'm going to tell you some of the signs and symptoms of hypoglycemia, and just let me know if you have any questions before we move on.
Okay.
Signs of hypoglycemia in the newborn include lethargy, apathy, limpness, poor feeding or sucking, vomiting, hypothermia in low birth weight infants, pale skin and cyanosis, periods of no respiration, irregular respiration, respiratory distress, and rapid breathing.
I understand all of these signs except cyanosis. What is that?
Well, cyanosis is the appearance of a blue or purple discoloration of the skin or mucous membranes. You would usually be able to see it on the lips, tongues, and fingernails. It's usually a sign of low oxygen levels in the blood. Do you have any other questions?
I don't think so. What other signs do I need to look for?
You want to look for low muscle tone, possible loss of the swallow reflex, tremors, jerkiness, seizure activity, irritability, eye rolling, high-pitched cry, and temperature instability. Do you have any other questions?
No, I know what they all mean, but wow, there are a lot of signs of hypoglycemia. What do I do if I notice one of these signs in my baby?
If you recognize any of these signs, you want to bring Taylor to the hospital right away so we can help her. It is important that you know what to look for. I'll give you a copy of the signs and symptoms that you can take home with you if you need it. Do you have any other questions?
No, but I will definitely take a copy home with me. Thank you.
You're welcome.
The nurse will now discuss preventative measures that mothers can take.
So I know you've received a lot of information about hypoglycemia, but I want to leave you with a few takeaway points.
Okay.
I'm going to give you 2 specific interventions that you can implement for your baby to help her maintain a normal blood sugar.
That sounds helpful.
The first of these is regular feeding of your baby. Are you breastfeeding or bottle feeding?
Bottle feeding.
Okay, early formula feeding is one of the major preventative approaches for hypoglycemia in your newborn. How soon after birth did you begin feeding Taylor?
I don't remember exactly. It was pretty soon after, though.
Okay, no problem. So long as you continue a regular feeding schedule, your baby's blood glucose is likely to remain above a hypoglycemic level. Do you have any questions about that?
I don't think so. It seems pretty straightforward.
Okay, the next intervention is swaddling. Can you show me how you swaddle Taylor?
I can try. I'm not very good at it yet. The nurses at the hospital make it look so easy.
That's because they get a lot of practice, and you will too, not to worry. Here's a basic demonstration of how to swaddle your baby.
According to the American Academy of Pediatrics, appropriate swaddling can work to calm infants and help them sleep. There are a few safety tips to consider when swaddling your baby. To reduce the risk of sudden infant death syndrome, you must always place the baby on his or her back to sleep. To prevent hip dysplasia, you must leave adequate space for the baby to flex his or her knees and hips. And you may consider placing the baby's hands near the mouth to allow for self-soothing by way of sucking. There is conflicting evidence regarding the 2 different approaches to swaddling. Please contact your baby's pediatrician for a recommendation.
baby Taylor wore. This reduces the likelihood of developing hypoglycemia.
Who knew? I will definitely do my best to keep her spoiled.
Excellent. Can you repeat to me the two interventions that we talked about?
I think I can. The first was early and regular feedings, and the second was swaddling, right?
Yes, that's correct. If you remember nothing else from this appointment, please remember these two preventative measures. They can really protect Taylor from the dangers of hypoglycemia.
Thank you so much for this information. It's been very helpful.
We hope you found this video helpful. For more information, please contact your healthcare provider.
Conclusions. In the present cohort study, neonatal hypoglycemia was not associated with adverse neurologic outcomes when infants were treated with the aim of maintaining a blood glucose concentration of at least 47 milligrams per deciliter, even though threshold glucose concentrations remain common.